When we talk about sinus classifications, we have to talk about where the different sinuses are. There's a sinus called the frontal sinus, which is in the front of the head. There is an ethmoid sinus, which is between the eyes. There is the maxillary sinus, which is underneath your eyes. And then there is the sphenoid sinus, and that sinus is behind your eyes. And all the sinuses are paired. So you have two of each sinus. So you could have pain in the left side, pain in the right side, or pain all over, depending on or discomfort, depending on which sinus or sinuses are involved in the process. This is a side view of the sinus, okay? So here is a turbinate, and turbinates are real important in the nose because they shrink and they swell and they control the pressure in the nose. When we look at this osteomeatal complex area, we can see that the frontal sinus drains into it. Here's the frontal sinus here. We see that the ethmoid sinuses will drain into it, and then the maxillary sinus drains into it also. So all these three sinuses drain into this one area here, and then here's the sphenoid sinus. The sphenoid sinus actually doesn't open up into this area at all, as you can see. So it starts out with something called inflammation, and this is a big term, but just remember, inflammation is an insult to the body's tissues from some external or internal source. So when we talk about chronic sinusitis, the diagnosis is a group of disorders characterized by inflammation of the mucosa, which is the lining of the nose, and sinuses of at least 3 months duration. And that's your diagnosis for chronic sinusitis. Now you can tell your doctor, I have chronic sinusitis and this is the reason why. So how do we treat this? Well, almost all patients who come to my office who have chronic sinusitis, most of them have been treated pretty well by their family doctor. But if they're not, then I will start them on intranasal corticosteroids. They're very well tolerated. They're fairly inexpensive now because a lot of them are generic. And they seem to help with the inflammation. They calm down the inflammation, open up the sinus openings, and reduce the infections that are occurring. The other one is antihistamines, oral or intranasal. Leukotriene inhibitors, Singular. It's probably the only one on the montelukast. It's not generic yet. Nasal mast cell stabilizers, I almost never use cromolyn. The other thing is nasal saline irrigation, plain old salt water. You can make it yourself. Usually with the patients, the two things I will use is the intranasal corticosteroids and about a half a quart a week at least of saline irrigation in both nostrils. Antibiotics I will use, and of course, not just for the low-grade chronic sinusitis, but I'll use it if there appears to be an acute exacerbation. You know, purulent drainage has started, they're getting headaches, they're getting a lot of discomfort, maybe their nasal congestion is increasing. Then I'll put them on a course of antibiotics. If all else fails after, 6 months, 3 months of real good therapy, then we need to do surgery. Chronic sinusitis requires opening the sinuses and removing some of the diseased tissue. But really what you really want to do is you want to open up the sinuses so they drain so that you can get the steroids in there and you can get the saline in there to clean everything out. A lot of people are familiar with the new type of gallbladder surgery where they have endoscopes. That's what we do with the sinus. We use endoscopes to get in there. Occasionally we do an external approach, but not very often anymore. Here's the endoscope inside the nose, and we're looking at various areas of the nose. And when I'm doing a physical examination in the office, this is how I do it also. Here's the blockage, okay, because we've got these polyps and tissue here. We take the endoscope and we take little forceps or things called microdebriders. They look like little rotor-rooters. And we rotor-root out the sinuses and the disease lining so that they open up sort of like this here and drain everything out. And here's the ethmoids, and so we'll take the rotor-rooters and the little cup forceps and take these all out. And of course, here's the brain, so you have to be really careful that you don't penetrate into the brain. So the exact cause of sinusitis, I don't know, but I'll give you some theories about bacteria. But you need a good history, a good physical examination, and remember, the history's from you. You're the historian. We're just a history taker. Good examination with the endoscopes in the office. The CT scan of sinuses, I always do medical therapy first. Sometimes it's all we need, oftentimes it's all we need, and then if everything else fails, we do surgery. And surgery is not 100% effective in everybody, okay? I wish it was, it's not.